Hey everybody, this is Dr. Blood here. Hey, we're going to talk about kind of the four-step process that we look at in terms of how do we get someone that has back pain to the point where it's either reduced, reversed to a certain degree, and ideally resolved. So step one, what we look at is we have to identify the pain generators. So when I talk about pain generators, it's one of those things that there's many structures in the back that can promote and drive pain. Anything from the facet joints to the discs to the nerves to the muscles, and a lot of times it's kind of a combination of all of those. So a lot of times we think I need an MRI or I need an X-ray, and in some circumstances that's true. However, in a lot of circumstances, actually, it can be counterproductive. Statistically, based on research, 50% of us walk around with asymptomatic disc issues. So it's one of those things that if we went and got an MRI because we have back pain, it's like, well, you have some disc bulging. Does that actually correlate and make sense to the reason your back may be in pain? So in my opinion, one of the best ways to figure that out is a pretty thorough and comprehensive physical examination. Now, in some circumstances, we need to kind of go on and get an MRI or an X-ray or something, depending on the history of things. That being said, that's not always the case because it can potentially lead us down the wrong treatment path. Now, if things aren't going the way they're supposed to, or they're just short-lived results, then diagnostic imaging can help further determine where do we need to get to next. What's the next appropriate specialist that we need to consult with for another opinion. But once we identify the pain generators, the second step is implement an appropriate care plan based on what we found on the exam. So if we find that there's muscle involvement, joint involvement, and say even disc involvement, then we have to positively affect all those tissues without aggravating and restore function. Remember, pain is like your check engine light. So it's one of those things that once we restore function and get under the hood, so to speak, and fix that, then that pain signal should start kind of shutting off. It should become a little more intermittent or less frequent or less intense, whatever the case may be, until the point where it actually resolves. So that's step two, is we got to implement the care plan. Step three is obviously we got to avoid aggravating activity. So a lot of times we end up in a scenario because we do a lot of repetitive things throughout the course of the day, and there might be certain things that we know kind of fuel the fire, so to speak. So when we fuel the fire and we can limit that or modify or mitigate that type of activity, then we need to do so to try to let the back heal the best we can. Now, sometimes we have to either work through it or circumstances in life we can't necessarily fully get out of it. However, we can try to mitigate or minimize those types of things so we can try to get the back to heal and restore that function. And then, of course, step four is once we get those results, we have to achieve longer-term sustaining results. So pain's a great motivator to do our stretching and to do different things to try to reduce pain. But a lot of times when pain goes away, we lose that reminder of stretching and doing the exercises necessary to keep the spine functioning. So it's one of those things we want to be able to implement just simple stretching at home to help again offset the repetitive things that we do out through the course of our life. So that would help get the long-term results that we want. So that's kind of the four-step process that we look at. Is we want to identify the pain generators, we want to implement the appropriate care plan, we want to try our best to avoid the aggravating activities, and then we want to implement a strategy to help long-term results. And in some circumstances that might actually be routine supportive or maintenance type care at chiropractic office or physical therapy, something supervised, one because it's scheduled and that helps us keep on it. But there might be circumstances where we need to actually help keep those the best we can. So but that's our process. So if it's one of those things you're struggling with back pain, what we can do is we can jump on a discovery call together, about a 15-20 minute phone call, and we can kind of go through it. It's not necessarily a doctor-patient relationship. We're not dispensing any type of medical advice, but what we're trying to identify is something that we often use to help people overcome chronic pain. Can that be implemented for you? So if you're interested in jumping on a discovery call with me, just send an email to DC, the letter D, the letter C, at apexphysicalmedicine.com, and just put in the subject line discovery call request, and we'll set up a time that we can discuss what you've been through and to see if it's something that our clinic can help you with. So hopefully that helps make sense. 4-step process to try to take someone that has chronic pain all the way to the point of less pain, no pain, whatever the case may be. So 4-step process. Hope you're well. If you have any questions, let me know.